Tonight, health experts are awaiting new guidance on COVID-19. According to the Washington Post, the Center for Disease Control and Prevention plans to loosen its COVID isolation recommendations as soon as this spring.
11 Alive's Grace King joins us to explain how this could affect the community.
I think what we already know is that people were concerned about testing if they had to stay home for 5 days, especially since we do not have paid sick leave in the United States consistently.
Jody Guest, a professor of epidemiology at Emory University's Rollins School of Public Health, is awaiting new guidance from the CDC. A Washington Post report citing 4 agency officials says they could shorten the COVID isolation period from 5 days to 24 fever-free hours.
This is actually very in line with what we already say for flu and other respiratory viruses.
The Centers for Disease Control tell 11 Alive they don't have any new guidelines to announce at this point, but that they'll continue to make those decisions based on the evidence and science to keep communities safe.
The newer data that might support this change would be based on how many of us out and about in the world have some level of immunity.
Georgia Federation of Teachers President Verdalia Turner wants to see that data.
Everything needs to be based on the medical science and good common sense.
She says COVID-19 is keeping educators and students out of the classroom. Shorter isolation periods could help those who feel better quickly.
Teachers want to teach, and we need them at work, but we need them whole and healthy. We have a teacher shortage for various reasons, and we don't want to add to that problem by losing teachers because they are ill or sick.
Still, Turner hopes it won't have unintended consequences, with people choosing to come out of isolation sooner than they should.
Anyone sick needs to stay home. If children have symptoms, they need to stay home. If parents have symptoms, they need to make sure that they quarantine themselves.
Grace King, 11 Alive News.